What's going on, YouTube Nation? We have a HOP patient ready to be served, so let's serve him with a smile. Let's not waste any time. Our patient has an ID armband with the patient's last name, first name, and date of birth. We always want to make sure that we correctly identify the right patient before we draw any blood. Sir, is your name Biff Armstrong, date of birth 12080?
Affirmative.
Oh, military.
Sir, yes, sir!
Now that we correctly identified the patient, we can move on to finding the vein. When it comes to the tourniquet, we're only going to apply it twice. Applying it more than 2 times is not necessary. The first time we apply it, we're going to find the chosen vein. Whether it's on the basilic side, or if it's going to be on the cephalic side, or sometimes you can have the straight median vein. Apply it twice. Continue to press on the AC. Veins could be anywhere, so just keep on pressing. Not all patients are going to have the same veins at the same locations. Once you find that vein, you're going to use a vacutainer or a syringe, depending on the size of the vein. Or if it rolls too much, anchor and use a butterfly. But either way, the tourniquet will be applied twice. If you're comfortable with your chosen vein, then set up all your equipment and get organized. Looking at our usual suspects, we have a transfer device in case if we use a syringe, a heat pack. To activate it, break that little seal, shake it, and then it becomes warm. It'll make a small vein big enough to draw the blood. Having this in your arsenal will make a difference. Alcohol pad, cotton ball to cover the sites, paper tape or Coflex. Most of the time, use paper tape. Blood thinners affect the platelets, the cells that stop the bleeding, so keep that in mind. Choose Coflex. Let's close the door. Much better. MD Kirby will soon bring his lab orders. We have everything set up. Apply the tourniquet, snug over the clothing. Not too loose, not too tight. Compress the arm. Let's get it over the clothing. Helicopter Herman is en route for the stack care package. This is the important step of finding that vein. Let's do it right the first time. Squeeze. Feel everywhere and massage the fluids towards the AC area. Take your time. Learn to prepare the vein. Here comes MD Kirby with his lab orders. Thanks, Doc. Veins can curve or be straight. Oh, this is a good vein. Yes, perfect. This vein is running across the cephalic side of the arm. We found our vein. Great candidate. Press to see how deep or superficial it is. Don't press light. Feel deeper. It does not hurt them. We're going to just use a butterfly on this one because it's more practice for us. We made our choice. We identified our chosen vein, so now let's take off the tourniquet.
Incoming!
Let's slap the paper tape over the glove, form a cotton ball. Thanks, Helicopter Herman. I appreciate the stat care package. That's a lot of tubes. How many tubes is this? Herman has perfect timing. Order of draw from left to right. Coagulation, chemistry, hematology, blood bank. We'll discuss each department in future videos. Here comes Messenger Cordial with a PSA. Good girl. Thanks. Our second and final application. Start tying them off. Always over the clothing. Put these to the side. Let's do it different this time. No vacuutaners as it's standard. I'll show you the butterfly only method. We need more than 12 cc's of blood. Syringe wouldn't be enough. When we use the butterfly, we have to leave the needle attached so we can start distributing it in each tube until all are filled. Let's rip our alcohol pad open. Start squeezing. Always squeeze once you start feeling everywhere. It's going to be right here. Clean the area. Press on the vein. When you press on it a few times. It's going to get irritated and get enlarged. That's what we need. Wipe it a few more times, then clean the fingertip to touch the above sites. We're ready to go. Let's uncap it, and then after we uncap it, feel above the punctured site. Get closer with the needle. Now let's go through the vein. Yes, through it. Perfect. And once you have it in, you're going to slowly let go of the butterfly. We need both hands to do this. Making sure that we are close together to prevent pulling it out. Exactly, no blood. Now pull back slowly and look what happens. Exactly. All we had to do was pull back. Now that we pull back, it's starting to flow. Let it start filling up. It has to reach that line. Blue tops come in 2.7 or 1.8 ml tubes. This one is 2.7. Arm stable, needle stable. Keep going, one at a time. The flow is excellent. Any movement can lead the needle out, interrupting the blood flow. And just continue down the line. 5 tubes all together. Nothing is moving, the blood's flowing exactly how it should. That's okay. We have our lavender. Just keep going. You don't always have to fill up the tubes. If it's more than half, depending on the lab orders though. Our blood bank tube. Uh-oh, patient's running dry. The more the better, but still half is enough. Looks like we're starting to run low on blood. When it comes to blood banks, just do half. Whoops, we sucked the patient dry. As soon as we're done with the final tube, we're going to be cautious and twist it off slowly. Last tube complete. Now let's take out the needle. Steady. One hand to hold the butterfly. Take out the needle straight. Press the black button. Needle is retracted. Throw the needle in the sharps that we don't have. Release the tourniquets. Continue to put pressure. If not, bruises will form. Always put pressure, and that gives you time to start labeling the tubes. Write your initials, time of draw, and dates. And as soon as the patient stops bleeding, make sure they stop though. Blood thinners delay the bleeding time, so continue until it stops. Very important. No oozing of blood. As soon as the bleeding stops, slap the bandage over. Excellent job, ladies and gentlemen. And that's all she wrote. Thanks for watching. Click on the next video to keep learning more about phlebotomy.